Fitting the TAP TL. The following technique should be used to fit the TAP 3 triple laminate. Have the patient place the upper tray in their mouth. Check for fit, comfort, and retention. In this instance, on the upper tray, there is a particular tooth that is uncomfortable. Use a thin, straight acrylic burr. Carefully remove a small amount of the lining from the area of the tray with too much retention. Be conservative with your adjustments. They should be very slight. Any over-adjustment may affect the retention of the trays. Fit the tray in the patient's mouth with each adjustment to avoid over-adjustment. Have the patient remove the upper tray from their mouth. They should remove the tray by starting from one side on the posterior and pulling down. Have the patient place the lower tray in their mouth. Check for fit, comfort, and retention. To remove the tray, have the patient push up on the posterior of one side of the tray with their thumbs. In this instance, on the lower tray, the appliance is too tight on the right buccal. To adjust retention, reduce the height of the flanges covering the teeth. Do not adjust the lining of the tray. Adjustments should be very slight. Fit the tray in the patient's mouth with each adjustment to avoid over-adjustment. Setting the initial treatment position. Have the patient place the upper and lower trays in their mouth. Train the patient to hook the trays together and unhook them. You may have to guide them until they become accustomed to hooking the trays together. Be sure to warn the patient not to bite down on the hook or socket, which could damage the hardware. Another way for the patient to place the device in the mouth is to hook the appliances together outside the mouth, and then place the conjoined trays in the mouth. Once the trays are in the mouth and hooked together, dial the patient forward to the patient's maximum comfortable position. Have the patient indicate when this point is reached. By taking the patient to their maximum comfortable position, you will know their range of protrusion. From the maximum position, dial the hook back and count the turns. Start the hook in the most retruded or back position. The hook will be all the way back against the posterior of the spindle and base plate. Have the patient turn the adjustment key a half turn forward or 180 degrees per night towards their left shoulder until symptoms are relieved. If any position becomes uncomfortable, instruct the patient to dial the hook back or towards their right shoulder until they are comfortable again. If the patient is still experiencing discomfort, have them make an appointment with you for an assessment of their TAP. If the patient needs more protrusion, the hook can be placed in two positions. The first position is in the slot of the socket. The second position is behind the slot of the socket, which gives the patient 6 more millimeters of protrusion. After the hook is set, the next step is to clear any posterior interferences. If there is any posterior interference, such as imbalance in the trays, or if one side is higher than the other, it could cause TMJ problems. Mark each side of the tray with ribbon. Using a burr, remove contacts indicated by the ribbon. Repeat this process until all contacts are removed. Once any posterior interference is removed, check for clearance on both sides of the trays. Any adjustment protrusively will further open the posterior. If you want to prevent the patient from disengaging the trays while in the mouth, the notch in the socket on the lower tray can be filled with acrylic. Mix cold cure acrylic. Place the acrylic in the slot and under the lower plate. Hook the trays together and slide the hook from side to side to clear the slot. Be sure not to clear any of the acrylic from the notch. Turn the upper tray 90 degrees in relation to the lower tray to disengage the hook. Again, leave the notch filled with acrylic. Cure the lower tray in hot water. Once the acrylic is set, trim and smooth the acrylic, and then polish it. Place the trays together by turning the upper tray 90 degrees in relation to the lower tray. Have the patient place the trays in their mouth. Make sure the acrylic is smooth to the tongue and the trays fit together properly.